Continue blood tissue. And we have learned the structure of blood, okay? It consists of blood plasma and the foam elements. How many percent is the blood plasma normally? 55. The foam element, 45. Make sure you got this one. And then we'll also talk about the function of the blood. The red blood cell, for example, the main function is to carry oxygen. It's very important function. And then the blood plasma, water carry a lot of things, nutrients, hormones. And then the proteins in the blood plasma, like albumin, globulin, and fibrinogen. There are 3 types of protein in the blood plasma. Okay? The albumins carry mostly for transportation, especially for lipid molecules, like cholesterol or lipid soluble hormone. The globulin mostly for fighting. This is a weapon. So you have 5 types of globulin. It's called the immunoglobulin. What is the most abundant one? Anybody still remember how to memorize the most abundant one? We say game, right? Game with D before E. So IgG, IgA, IgM, IgD, and IgE. That's the 5 immunoglobulin or antibodies in our blood that will fight against infection. Now we also have white blood cell. And the main function of white blood cell is to fight infection also. Anybody still remember how to memorize the white blood cell from the most abundant one to the least abundant one? Never let monkey eat banana. So neutrophil, lymphocyte, what is after that? Never let, monkey. Monkey is monocyte. Eat eosinophil. Never let monkey eat banana. Basophil. So that's how you memorize that. Neutrophil fight mostly bacteria. Lymphocyte mostly fighting against viruses. Monocyte also fighting bacteria, but usually used for long-term infection. And then eosinophil mostly for parasite, sometimes also helping us against allergy. And basophil is for allergy, fighting allergens, allergic reaction. That's the white blood cell. The last one, platelet or thrombocyte. This is for clotting the blood, help us against bleeding, blood loss. Now we'll continue the formations of blood, where the blood is synthesized. All blood cells are synthesized in, anybody still remember the organ, the place for making blood cell? It is in your bone, mostly between the spongy bones, the place or the space between the spongy bone. Anybody still remember? That's your last.
Metaphysis?
No. Metaphysis is part of the bone. There is a space between the spongy bone. It starts with the red bone. What is the other one? Marrow. Red bone marrow. In red bone marrow. Sometimes it's called the RBM. In the bones. So it is actually located inside the bone. So your bones, it has special area, it's called the red bone marrow, that will produce all type of blood cell. The red blood cell, the white blood cell, also platelets, all of them made in America. No, made in red bone marrow. Okay, now, before we go there, I just want to give you information. All the cell is created from, there is a special cell which is the ancestor for any other cell. It's called the stem cell. What? Stem cell is the progeny of cell. Are you with me? So stem cell. Now, this is just a theory for you. Okay? This is just information. There are 3 types of stem cell. The first one is called the totipotent stem cell. What does that mean? It means total. Total. It means that all. So is this stem cell able to can make all type of cell, right? Tissue, organs. Okay? So all our cell or our organ, our tissue is actually coming from a stem cell. It's called the totipotent stem cell. Example for this totipotent cell is zygote. Anybody know what is zygote? Zygote is a one cell that is combined from sperm and eggs, right? And then just from one cell, zygote, it can create us, can create all cell. Therefore, zygote is example of stem cell. Another example that is really used for many research is called the embryonic. Embryo, baby, especially the early embryo. And this is the one that's become kind of famous for stem cell research. So when scientists doing stem cell research, what they use? They use cell from embryo. Because what? Embryonic cell, they can make everything. Make us, is create us. But there is a limitation, there is a prohibition, especially in the United States, you cannot use all embryo. Otherwise, some woman can sell their embryo for a research. So you cannot just really use any embryo. There is a special embryo in United States that you can use. There is a line for that one. You cannot just asking some mother that pregnant to give up their baby, for example, and then use for stem cell research. It is not allowed. It is prohibited. But just for information, embryo is example of totipotent stem cell. Totally can make everything. The second one is called the pluripotent stem cell. Pluripotent means it can make several types of cell, but not all. Several types of cell. Can make several types of cell. Example for this is the one we're gonna learn today, is the pluripotent hematopoietic stem cell. Which is, from the name, this is blood. This is the blood cell, the blood stem cell that can make different type of blood cell. So this from this pluripotent stem cell, so this is actually here. This is blood cell. It can make 2 lines of stem cell. The first one is called the myeloid stem cell. And then the second one is called the lymphoid stem cell. Where do you think this pluripotent hematopoietic stem cell located? Anybody know where this cell, this stem cell are located? The place for making blood cell, what is that? Mason? What is the place for making blood cell? The specific name? Red bone marrow, So in the red bone marrow, we have pluripotent hematopoietic stem cell on it. And then from this stem cell is divided into 2 lines, myeloid and the lymphoid. Get it? This lymphoid is easy. This is the one that make the lymphocyte. This is the one make lymphocyte, which is we have two type of lymphocyte. It's called B cell and T cell. Maybe you have heard T cell, B cell. We're gonna learn that also later, especially when we are talking about the immune system. And then the myeloid stem cell can make the other blood cell. Of course, red blood cell. Erythrocyte. This is red blood cell. What else? Platelets. Platelet name is thrombocyte. Thrombocyte. Platelets. And then over here, the other white blood cell. Neutrophil. What else? Basophil. Eosinophil. And the monocyte. So all of them coming from myeloid. The one that coming from lymphoid is lymphocyte. So all, you see that one? This stem cell able to create several type of cell. Therefore, it's called a pluripotent stem cell. You get this one? Another one, the last one is called a unipotent stem cell. This is the one that only make one type. One type of cell. Example, our skin cell, right? Your skin cell is always created every several days, maybe every 10 days. Remember the keratinocyte? There is a stem cell for keratinocyte. That keratinocyte stem cell only make keratinocyte. It cannot make anything else. So the same, all skin cell coming from this keratinocyte. Keratinocyte making keratinocyte. That's unipotent. Can you follow this? So there are totipotent, pluripotent, and unipotent type of stem cell. For the stem cell research, people mostly using this embryo because this is totipotent. In our lecture today, we're talking about blood cell. They are made in red bone marrow, and they are all made from one type of stem cell. It's called the pluripotent hematopoietic stem cell. It's make all type of the blood cell in the red bone marrow. Do you have questions so far? Now you don't have the question. Then we continue with classifications of blood cell. I'm gonna erase this. Okay. So classification of blood cell. Okay. Now this blood cell can be divided. Of course, we're talking about our lecture. Our course is anatomy and physiology. So we're gonna classify this blood cell based on structure or anatomy, and then based on physiology. Okay. Based on anatomy, it's divided into two two main types. The first one is called the granular blood cell. Okay, and then A means no. Okay, agranular blood cell. Okay. So over here, this division is mostly for white blood cell because we have several white blood cells. We're gonna say granular white blood cell, right? Because red blood cell is the same, it's only one type, right? So the white blood cell, there are several types based on structure. It can be divided into granular. What does granular mean? Granular mean on that, if you see under the microscope, on that white blood cell, it has granule, look like a crystal in it, right? It has a lot of crystal, therefore it's called the granular. Agranular means no crystal. So under microscope, it's very clear. You don't see any sandy or crystal structure in it. Right? Now, for the granular one, it has three types. Right? The first one is neutral. Neutral means the granular is very rare. It's very rare granule. Right? Sometimes you cannot really see them because it's very rare and very clear in color. And this is called the neutrophil. So this is neutral. The granular is rare and sometimes is a little bit clear. Get it? Right. Now the neutrophil, let's say the granular, I'm gonna put here, is not that many granular. Right? And remember last time we mentioned neutrophil, it has one nucleus with many lobes. Right? So if you see under microscope, it's gonna be look like this. That's the neutrophil. That's the structure, right? The second one is basophil. Baso means blue. Right? Basically, the dye that we use for staining the blood cell is the blue dye. Therefore, for the basophil, the granule is actually will be stained really clear. So mostly you're gonna see the blue granule. What is the nucleus? Nucleus is very, you can see it, but it's very kind of fake because of the cover by this granule. So mostly the one that you see are the granule. Of course they have nucleus, they have nucleus, but it cannot be really seen, covered by the blue granule over here. That's the basophil. The next one is eosinophil. Eosin means acid or red. Therefore, under the microscope, you're gonna see the granule actually red or pinkish in color. Right? So the granule is like a little bit reddish with the nucleus that look like earphone. Okay, that's the structure of eosinophil. And you already saw this last time. Maybe you saw it, maybe not, but mostly everybody should be able to find a neutrophil because neutrophil is the most abundant one. That's the granular. The agranular, the one that do not have granule, consists of two types, which is lymphocyte. So lymphocyte, it has two types, B cell and T cell. But both of them is very similar under microscope. You're gonna see the lymphocyte like this. No granule, of course, it's really clear. And the nucleus is really big. Almost cover all the space of this cell. So it looks like filled with the nucleus. That's lymphocyte. And again, many of you should see this one because this is the second abundant white blood cell in our blood. And then the monocyte. Sometimes monocyte is also called as a macrophages. Because what? Because they are really big. This is the biggest white blood cell. And they can eat. Phage means eat. They can eat bacteria. They can swallow bacteria. They are able to create a mouth structure. So under microscope, you're gonna look like this. Big, no granule, of course, clear. This is agranular, and the nucleus is look like kidney. Okay, maybe some of you saw this last time under the microscope. This is the third abundance part of white blood cell in blood sample. This is based on structure. Now, based on function, we have five types over here. And again, based on function, I'm gonna list this based on the abundancy. Again, never let monkey eat banana, just like that. Never let monkey eat banana. Neutrophil, lymphocyte, which is B cell and T cell. Okay, and then monocyte, eosinophil, and basophil. Okay, basophil. Again, we mentioned that neutrophil mostly eat bacteria. This is also phagocyte. Eat bacteria. Okay? Eat bacteria. Lymphocyte. The lymphocyte, the B cell, this is the one that actually produce antibodies. So our antibodies actually produced by the B cell. Antibodies or the immunoglobulin, the IG. You still remember how many types of IG? 5. Right? So IgG, IgA, M, D, E. They're all produced by the B cell. So our B cell is the one that produce the antibodies. And it is produced only when we have infection. If we don't have infection, we will not create antibody. That's the reason why antibody can be used to know whether you have infection or not. Like for example, COVID-19, right? COVID-19, when you check whether you have COVID-19 or not, they can check by antibodies that is produced in your blood, in your body. Okay? So it is produced by the B cell. The T cell over here, this is the one that kills bacteria. Viruses. We're gonna learn this in the next chapter, chapter 20, when we talk about immune system, how they kill viruses, how they eat bacteria, for example. What? We're gonna learn that later. But right now, just for your knowledge, okay, the lymphocyte, there are 2 types. B cell produce antibodies, the T cell kill viruses. Neutrophil eat bacteria, therefore they are called phagocyte, cell eaters. Monocyte, this is also phagocyte, therefore called the macrophages. This is also eat bacteria. Now what is the difference? The difference with neutrophil, when you have the first infection, let's say you have cut in your skin and then there is bacteria enter into the cut, the one that coming there is going to be neutrophil. Why? Because they are smaller. They can run faster. to the infectious area. So they are the first worker that will eat bacteria, fight the bacteria. This monocyte over here is bigger, fat. Okay, we can have fat. They're gonna come last, very slow movement. But when they come over there, they can eat hundreds of bacteria in one time. Over here, neutrophil maybe only 2 to 10 bacteria in one eating. But monocyte, they can eat hundreds of bacteria in one eating. And they also can stay on that infection area for a long time. Therefore, they usually stay for a longer infection. Even some of them stay forever there. And we talked about last time we talked about the bone cell. There is an osteoclast. Osteoclast actually macrophages. Osteoclast. And when we talk about the skin cell, there is a cell is called there is a Merkel cell for touching, and the other one is Langerhans cell. So Langerhans cell is actually macrophages that stay in the skin. They stay there forever to help us again infection. In your brain, you also have special cells that stay there in your brain cell, and also in your lungs you have type 3 lung cell that also actually monocyte or macrophages. So they fight, they eat bacteria for a longer time of period. Eosinophil, this is the one that fight against parasite, including worms, okay, malarian parasite. There will be job of the eosinophil. And basophil, this is the one that mostly fight against allergens. Allergen is anything that can cause allergic reaction into our body. Maybe some of you have the pollen allergy, some of you have, what else? What kind of allergy? Hay, some of you maybe have an allergy against cat, what? Cat dandruff and etc. That's all of them is called allergens. And the one that really try to fight them is basophil. So basophil used for fighting the allergen. So if you see over here, again, it looks like an army in our body. Just like a nation, United States for example, they have different type of army, right? What do you call the army that fight on the air? Garen, what army in the United States that fight on the air? What type of army that fight?
Like Air Force?
Air Force, right? They have name Air Force, right? How about the one that fight on the sea? Navy, right? Just like this, we have name. This name is just like different type of army in our body. Fight against bacteria, viruses, parasite, allergens. Okay? Okay, so that's the classification of white blood cell based on structure and also based on function. You got this one? Hey, now we're gonna continue. The way they will fight, okay? The way how they fight, we will discuss this on, I believe, chapter 20. Okay? So right now we just give you the information of their function, but the way they fight or the way they do their function, we will discuss it on the next chapter, which is chapter 20. Now, the next topic will be how we stop bleeding. Stop bleeding. It's called the hemostasis. How we stop bleeding. Let's say you cut your finger. You're gonna be bleeding, right? Do you think you will be bleeding forever? No, because your blood will be clot. Will be clot. That clot is actually the way we try to stop bleeding. Okay? There are 3 steps of stop bleeding. Right? The first step is called the vascular spasm. Right? Vascular spasm. Right? Now, let's say this is blood vessel. Okay? Let's say there is a cut over here. Right? What happened? You're gonna be bleeding, right? You're gonna be bleeding over here. Right? Let's say this blood is going that way. Hey, you with me? Now, just imagine if you have hose, your garden hose, and then that garden hose actually cut somewhere in the middle. What usually you do to stop, at least the first step to stop that water for, losing from the water pipe. Usually we're gonna pinch it, right? We're gonna pinch it. Okay, so come on, you're gonna call your kid, turn off the. But the first thing that's gonna do, you're gonna pinch that, right? The same thing with this, and when we have a cut in the blood vessel, what happened? Our smooth muscle on the blood vessel will constrict. So somewhere maybe over here, it will constrict. Pinch the blood vessel. This is what we call the vascular spasm. So this is smooth muscle constrictions. Remember, smooth muscle is involuntary muscle. It will do it by itself. This is kind of automatic action. Boom, right? You with me? Now, do you think there is still blood goes through this pinching? Yes, the same thing with your garden hose. Even though you pin, there are still going there, but at least less. At least less flowing. Are you with me? That's the first action. Second action is called the platelet. Plaques. Remember platelets? This is one of the blood cells that help us against bleeding. What is actually the platelet do? Remember, in our blood we have different type of cell: white blood cell, red blood cell, and platelet. So platelet, when we have bleeding like this, it will come to here, and then all of them will be here. But many of them will run to this place and plug the hole. Therefore, it's called the platelet plug. It's plugging the hole. You got this one? Yeah, that's the second step. And again, this is automatic action. Okay? And then what happened if you plug over this? Do you think you still have blood going through this damage? Yes, a little bit. It will still go. So at least less. So we have to do the last step, which is we have to seal that. We have to seal that damage or cut by what we call the blood clotting. Because plug is just a plug, it's actually not really sealed. So for the blood clotting over here, we need the fibrinogen. Remember, there is three types of proteins in the blood plasma: albumin, globulin, and fibrinogen. This fibrinogen is the one that will clot the blood. So this fibrinogen is a dissolved protein, but when we are bleeding, with the addition of calcium, vitamin K, it will become like a thread. You know, thread, the one that for, if for some woman, if you do sewing the clothing, You use thread, right? Is that the correct pronunciation? Writing or spelling? Thread, like, you know, for sewing. This is the correct spelling or not?
Oh, thread?
Yeah. Oh, D. D.
Yeah, D.
Okay, here you go. Yeah, that's you see it sometimes. Thread. Yeah. Using for sewing, right? So this fibrinogen become thread. Protein is called fibrin. So it changed the protein from fibrinogen to thread fibrin. Okay? And that thread fibrin will seal the hole. And here we need what? We need calcium, vitamin K for this one. That's the reason why people that don't have enough vitamin K, for example, like hemophilia people, they don't have really able to plug or to clot the blood. They're going to be bleeding for a long time. We also need calcium for this process. Okay? So this is the last step of stopping the bleeding. You have question for this one? That's not that difficult, right? This is makes sense. You start with constriction, which is spasm, and then plaque formation. This is the platelets will plaque that. And the last one is seal the hole by creating the thread, fibrin. Okay, so that's the 3 steps for stopping our bleeding. Okay, you have questions so far? Okay, if not, we go to the last topic, which is blood typing. You did already last time, typing the blood. Typing means to know the type of blood that you have. Okay, so blood typing. Okay, so I'm gonna use a table for explaining this. Okay. First, we're gonna use what we call the ABO blood type. Okay? So we're gonna use the ABO blood type system because there are 2 types blood system actually, ABO, and the second one is the rhesus blood type. We're gonna start with the ABO blood type first. Okay? Now, for the ABO blood type, let's say this is blood type over here. Okay. So for the ABO, how many blood type that you have? ABO only. I say it's ABO only. We are not combining with the rhesus blood type yet. How many? How many ABO blood type? How many type?
6.
No. 8 is going to be when we combine with the rhesus. But it's separate. We're going to explain this separately first. How many?
36.
No, come on. 3 is too little. Come on. What blood type you have? A, what else? Don't forget about rhesus. Forget about negative positive. We only talking about the ABO. How many? 4. What is that?
AB.
Here you go. Okay. 4. Okay. What is the first one? Let's say we use just based on the letter A. Okay. What is the second blood type? Based on ABO. B. What is the second? What is the third one? AB. And what is the last one? O. Okay. We have to explain this one by one because if it is together with the rhesus, it's going to be a little bit confusing. But later, after you know one by one, you can combine it easily. Right? So for the ABO blood type, here. Okay? Now, again, in our blood, we have two components. We have two components, okay? 45% of what? 40% of form elements, which is cell, and 55% of blood plasma. Get it? Okay? So, for the form elements, when we're talking about blood type, the one that's really used is only red blood cell. So we have red blood cell, which is the most abundant cell in our blood, right? This is the most abundant form elements in the blood. Get it? Now we have plasma. Okay? Blood plasma. Okay? We have the blood plasma. Are you with me? Now, we're gonna put over here transfusions. To help you understand the blood transfusion. Now, someone that have A blood type, how many of you have A blood type? Do you have A? How many of you A? B? AB? O? O. How about the others? You don't know? You never, you never. You can do it tomorrow if you want it. If you can come to the lab, I have the pinching that able to know your blood type. Eh? Okay, so A. What is A mean? A mean that this person in their red blood cell will have the proteins, which is called the antigens. Okay? So red blood cell have a protein that attach on their cell membrane is called the antigens. Okay? There are two types of antigen for blood typing, which is A and B. Are you with me? Now, if you are blood type A, your red blood cell will have antigen A. So you have antigen A over here. Let's say look like this. Look like pyramids or triangle. Are you with me? You can follow this? Now, if you are B, what happened to your red blood cell? Your red blood cell will carry another type of antigens. Let's say we're gonna use square. This is antigens B. Right? So if you are B type, then your red blood cell will carry the antigen B. Okay. Now how about if you are AB? What antigens will be in your red blood cell? If you are AB blood type? A and B, both of them. So your red blood cell will be look like this. You have A over here, B over here, maybe A over here, B over here. Okay? So antigens A, antigens B. Are you with me? Now, if you are O, if your blood type is O, what type of antigens will be carried in your red blood cell? Anybody? Sarah? If you are O blood type, what antigens will be on your blood, in your red blood cell? You only have two types of antigen, antigen A and B. Then no antigens. Your red blood cell just smooth like this. Can you follow this one first? This is the rule. Someone that have A blood type will carry antigen A. If you're B, then you carry antigen B. If you are AB, you carry both. If you are O, you don't have antigens on your red blood cell. Get it? Now, this is the rule. This is the rule. Antibody fight antigens. Okay? So when there is antigen enter into your body, then your body will create antibodies to fight them, to kill them. That's the role of immunity. Okay? So our antibody is created inside our cell, inside our blood, to fight these antigens that enter into our body. Now, this antibody is very specific for specific antigen. They cannot fight any antigens. Therefore, let's say antibody A will destroy which antigens? Antibody A will destroy what antigen? It's very specific for that antibody. It's going to be the same. It will destroy antigen A. That's the rule. Antibody B will destroy antigens B. Are you with me? This is the rule first. Now, remember your blood plasma, which is you have, let's say you have B cell produce antibodies into blood plasma. So your antibodies will be available in the blood plasma. Now my question is, if you are blood type A and you have antigen A in your red blood cell, okay, will you produce antibody A in your blood plasma? Look at this connection. Make a logical conclusion from it. If your blood type A, you have antigen A in your blood, will you produce antibody A? Yes or no?
Yes.
It means that you will die. Why you will die? Because that antibody A will kill your antigen, will destroy your blood. You with me? Can you follow this? Now, the next question. If you are on blood type A, will you produce antibody B? Yes or no? Daniel? Yes, because no problem. No problem. Right? So, if you are antibody or you are blood A, you will have antigen A in your red blood cell, and you will produce antibody B. It's gonna be look like this. Antibody B look like this. Why is look like this? Because this is gonna be destroy the square one, not the triangle one. This is just a model to make sure you know the connection. Are you with me? So you will be able to produce antibody B. Get it? Now, if you are A or if you are B blood type, will you produce antibody A in your blood, in your plasma? Yes. Yes. So produce antibody A. Gonna look like this. It's only killing the square one. The triangle one. Can you follow this one? This is actually what happening in our blood. Okay? It doesn't really look like this is gonna be fit with the structure of the antigen. Now, if you are AB, now this is the question. Will you produce antibody A? No, because it will destroy your blood by destroying this antigen A, right? Will you produce antibody B? Yes or no? No, because if you produce antibody B, it will destroy this one. It's actually killing you. It means that you will not produce neither A or B. Neither A nor B antibodies. There's no antibodies for blood in your plasma. Are you with me first? Eh? So there is no special antibodies for destroying the red blood cell because your red blood cell carry both antigen. Now the question for the next one, the O. If you are O, will you be able to produce antibody A? Yes. Will you be able to produce antibody B? Yes, because you don't have antigen over there. Okay? So both antibodies A and B. So you're gonna have this and also this. This is A, this is B. Antibody B. Yeah. Can you see this one first? Now, look, we're gonna combine this by knowing which one is the best for transfusion, which one is not compatible for transfusion. You will kill the donor, the recipient, if you do that. If you put the blood on him or in him, the wrong blood, he will die. Because what? His blood will be destroyed. Okay? Now, question. First, if you are A, let's say you are A, can you give blood to another person with A blood type? Yes or no? Of course yes, because you are having the same blood. When you're giving the blood, is you actually giving this, giving the red blood cell. So when you are A, you're giving this red blood cell over here with antigen A into somebody. If they have the same blood like you, yes, you can give to A. Okay? So A can give to A. Okay, can you give your blood to B? Let's say this is your blood over here. Can you give it to someone with B? Can you? Or not? Why? Because when you give that blood to B, he will create the antibody A. You give A, and there is antibody A in B blood, he will destroy this blood. He will destroy your blood that you give it to them. By destroying it, what happened? It will clog the circulation. Are you with me? Because it's going to be a lot of trash on the blood. So you cannot give it to the B. Can you see this one? Now, if you are A, can you give blood to AB? Yes or no? You give this, and then look, AB. Does AB have any antibodies? No. It means that yes, you can give it to AB. It doesn't matter. You give this antigen, but there is no antibodies over here. He does not create antibodies. You are okay. He will be okay. So you can give it to AB. Can you follow this? So you can give it to AB. Yes, over here, no problem. This one is no. Oh, this one, yes. Okay? Can you follow this? Now, can you, if you are A, can you give it to O? Can you give your blood to O, people with O? Yes or no? No, because what? Because O also create this A, right? Antibody is A, so you cannot give it. No. They will die. Okay? Are you with me? That's how transfusion is created. I mean, how to know whether it's compatible or not. Okay, now, let's say you are B. You are B. Can you give your blood to A? Can you give it to A? No. Can you give blood to the same B people? Of course, yes. So this one is yes. Can you give blood to AB? Can you give it to the AB? Yes or no? Of course, yes, AB doesn't have antibody, yes. Can you give it to O? No, because O have antibody B over here, no. So you can give it to B and AB person. Can you follow this? Next, AB. Look at, anybody have AB? This is the most stingy people here. This is very stingy. Why stingy? Look, can you give blood to A? Can you give your blood to A over here? Yes or no? Daniel? Come on, AB have both antigen. And then A create antibodies B. It means that the antigen B over here will be destroyed. You cannot. That's the reason why I say he's the stingiest one. AB is the stingiest person. When we relate it to the donor thing. So no, you cannot give to A. If you are AB, can you give it to B? No, because B have A and then AB also have antigen A over here. No, you cannot give it to. Can you give it to AB? AB, give it to AB? Of course, yes. That's the only. That's the. If you are AB, can you give it to O? Really, really no, because they have both antigen and both antibodies over there. Gone, die. So no. Okay, so AB can only give to AB. Stingy. Oh, I doesn't want to say stingy, but in related to the donor, AB only can give to AB. Okay, now the last one. Over here, O. Look at O. I want you to look at O first. Look this one. You actually giving this. Do you see any antigen? No. It means that it doesn't matter whoever you give, they will receive. Because you don't have antigen. It doesn't matter they can create antibody or not. It doesn't matter because there is no antigen to fight. Are you with me? So you can give it to yes. You can give it to here yes, yes, and yes. What? So all person can give to A, B, AB, and O. Are you with me? Now, from this information, which one that you can call universal donor? A person that can give to everybody, the most generous people. Oh, so this is universal donor. Are you with me? Now, from this information, which one do you think you can call the universal recipient? Can receive blood from any blood type. The one? The AB. You see the AB? AB, 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 AB. So AB is the universal recipient. So you're happy camper. If you're bleeding, if you have accident, you can take any blood. If you are AB. But if you are O, you only receive from O. You cannot get from anybody else. Only O that can go to your blood. Can you follow this one first? The ABO blood type. If not, you got this right. Now we go to the second blood type, the rhesus. Rhesus blood type. For the rhesus blood type, only two. I'm going to erase the rest over here. We don't really need. Okay. Okay, now, rhesus. blood type. Okay? How many rhesus blood type? How many type if it is rhesus? Sarah? 2, which is what? Positive and negative. Okay? After this, then you can combine with the ABO. Okay? Now, positive. What is positive mean? It's very similar with ABO blood type. The one that have positive blood type is mean that it has antigen. The antigens are gonna use different notation. Let's say round. Right? This is called the antigens RH. Rhesus antigen. You mean? If it is negative, then it's gonna be like this, just like O. Huh? Are you me? Now, the same over here. If this person is positive, do you think they will produce antibody rhesus? Yes or no? If they carry antigen rhesus, will they produce antibody rhesus on their blood? Yes or no? Gonna be no, because the antibody kill antigen, right? So no. No antibody RH. If you are negative, then what happens? Yes, you will produce the antibody rhesus. You follow this? Now, if you are positive, can you give blood to other people that are positive? Yes or no? Of course, yes, right? You are the same. Yes. Now, can you give your blood? This is yes. Can you give blood to person with negative? Yes or no? Sini? Look at the connection, yes or no? Daniel? No, because you give antigen and this person create antibodies. They will die, right? So you cannot give it. So positive only give to positive. Right? This is the other stingy one. Right? Other stingy. Right? Now, if you are if you are negative, can you give it to the positive over here? Yes or no? Yes, because what positive don't have, and you also don't have thing over here. You with me? So it's really yes. Okay? Nothing with nothing is nothing. What? Now, can you give it to another negative person? Of course, yes. You have the same blood. So yes. So you can give it to positive and negative. Okay? Now from this information, can you tell me which one is the donor, which one is the recipient? Positive, donor or recipient? Recipient, what? How about negative? Is the donor. He can give to anybody. Now, if you combine the ABO blood type, then, okay, if you have AB positive, right? This is the real, right? This is the real universal recipient. It means that it doesn't really matter, any blood can go to you. It doesn't matter ABO or rhesus type, they all, you can receive all of them. And the real donor will be the O negative. If your blood is O negative, you can give your blood to anybody. Real universal donor. Okay? If you are O positive, you still you are donor with ABO, but it's not donor for negative and positive. So O negative is the real one. Are you with me? Now, the last thing, it is happenings actually with this rhesus blood type, positive negative blood type. it actually can cause problem with baby. With baby. There is a disease called the hemolytic disease of newborn. Hemolytic disease of newborn. What does hemolytic mean? Lytic means destroy. Hemo means blood. The blood of the baby will be destroyed because of this incompatibility. So incompatibility of marriage. So maybe in the old time you might have people that don't have baby, or if they have baby, usually the baby will born dead. What do you call it? Stillbirth, or that's actually sometimes is caused by this. It's only scenario, right? Only scenario is when the female or the mother is negative, mother, and father positive. It will cause this incompatibility. Now what happened? Let's say this is mother. Okay. I shall look like that, okay? And this is the father over here. Okay? Father just like that. Okay. Now, what happens when the father give something to the mother, and then kaboom, the mother will be like this. And what you have? What the mother have? Baby. I don't know what they do, but they have baby over here. Okay. What is happening? Okay, now, when the father is positive, just like a transfusion, what is actually the father give? Give the blood, right? That have antigens. Are you with me? And this actually not go to the mother, but go to the So the kid actually carry the same type of blood like the father, which is what? Positive. If the kid positive, what does that mean? It has antigen over here. Antigen resist. And the mother is negative. What does negative mean? The mother able to create antibody resist, like that. Are you with me? And these antibodies basically will go to the baby and destroying this baby blood. What happened with the baby? He died. So mostly will die. Maybe the first born maybe still okay because less antibody produced, but the second, the third usually just die, stillborn. Okay? Can you see this one? This is the reason why if you go to a doctor and you are negative blood type, if the woman negative blood type and you are pregnant, usually the doctor will give you the injection. What does the injection do? Blocking this production of antibody. In the modern time, you have that ability, but a long time ago, nobody knows. They just have, dead baby or baby born dead. This is what we call the HDN, hemolytic disease of newborn. I think we're done with chapter 18. So again, make sure print out your assignment and then start filling out.